Hi guys, welcome back to my channel, Life of a Caribbean Nurse. It is your girl Nurse Ray. Today we'll be speaking about blood pressure. So what is blood pressure? How is blood pressure measured? What does the systolic reading mean? What does diastolic reading mean? What is hypertension? What is hypotension? What are different classes of high blood pressure medication? We're going to be listing some of the common medication that come under each. And then at the end, I'm going to show you guys a table basically that shows what a normal blood pressure is supposed to look like, what an elevated blood pressure looks like, what hypertension looks like, and what hypertension crisis reading looks like. Guys, I really hope that you guys enjoy this video. For those who have not subscribed, please remember to subscribe, leave a comment. Let me know, guys, what other materials you want to see, and share the video with a friend also. Okay guys, let's get straight into it. So what is blood pressure? Blood pressure is the force that the heart uses to pump the blood around the body. Blood pressure is a force that the heart uses to pump the blood around the body. When a blood pressure is done, there are two numbers that we see. An upper number known as a systolic number and a lower number known as a diastolic pressure. So we have the upper number, the systolic pressure, and the lower number, the diastolic pressure. What does the systolic pressure means? The systolic pressure basically is a pressure that develops when the heart pushes the blood out. So the systolic pressure is a pressure that develops when the heart pushes the blood out. The diastolic pressure now is a pressure that develops when the heart rests between beats. Hypertension, also known as high blood pressure, occurs when the force of blood pushing against the walls of the blood vessels is constantly high. So hypertension occurs when the force of blood pushing against the walls of the blood vessels is constantly high. There are two types of hypertension. You have primary hypertension and secondary hypertension. Primary hypertension, usually the cause is unknown and is said to be linked to genetics. So your mother have it, your father have it, and that's why you end up with it. Or aging, you're getting old, the heart is not pumping as good as it used to do in your younger days, so you end up with high blood pressure. Dieting, you're not eating properly, so you end up with high blood pressure. Or, it just occur and they're not sure of what happened or how it's happening. In secondary hypertension now, there's usually an identifiable cause. So sometimes, the walls of the artery has been narrowing. So the artery used to be this big, and now it's like this. So it takes a lot more force for the blood to come through the walls of the artery when it's narrowing. Also, in secondary hypertension, it's sometimes reversible. It can be treated and reversed. Both of them can be treated now, but secondary hypertension is sometimes said to be reversible. Hypotension, also known as low blood pressure. Hypotension occurs when the blood pressure drops below normal. So many things can cause an individual to become hypotensive. So it can be that you're dehydrated, and there's not enough blood being pumped around the body, so you realize you're hypotensive. It can be that you're in an accident, you start to lose a lot of blood. You find you become hypotensive because there's not enough blood going around the body. That can also lead to like a shock, right, and lead to death. An allergic reaction can cause you to become hypotensive. A lot of reasons can cause you to become hypotensive, but usually high blood pressure is said to be a lot more dangerous than low blood pressure, because low blood pressure in many cases can be easily treated and reversed. Okay, So there are many different medications that is used to treat high blood pressure depending on what is going on with the patient. So that's why assessment is important, because you can't just give anybody, say, all right, your blood pressure high, so you want enalapril, all this. Your blood pressure high, so you want captopril, all this. So you want nifed, swallow this. You know, we have to think about the patient and what's going on with the patient and what the patient requires. So that's why they have many different classes of high blood pressure medication, right? So we're not going to be talking about all the classes today. That is not possible. I'm going to be addressing 4 of the class of medication. So I'm going to be speaking about the beta blockers. I'm going to be speaking about the ACE inhibitors. I'm going to be speaking about the diuretics. And also I'm going to be talking about the calcium channel blockers. So we're going to be doing 4 of them today. All right, so I'm going to be telling you what they are, and I'm going to be telling you some of the medication, the common medication that comes under each of these class of antihypertensive medications. All right. Okay, guys, so we're going to be starting with diuretics. If you see me looking now and then, it's because I made an actual slide to do the presentation. So what you guys are going to be seeing in the video is a slide 2 with the information. So I'm going to just be doing a brief presentation orally with this, and then the slide is there so you guys can read along. All right, so we're going to be speaking about the diuretics. They also call diuretics water pill or water tablet. If I hear people say water tablet, that me can't stop people. If I take the blood pressure medication, I just have people. So those are the diuretics, right? All right, so you have different category of diuretics medication. You have the loop diuretic, you have the thiazide diuretics, and you have the potassium sparing diuretics. Because sometimes you find, like when you take the loop diuretic and the thiazide diuretic, it causes you to lose very important minerals from the body. For example, potassium. So you have diuretics that also are potassium sparing because they have potassium in them, right? So there are different types, as I said. So you're going to be seeing this slide over this side, basically, that has shown you, say, on the loop diuretics comes Lasix, you know, on the thiazide diuretics come isochlorothiazide, and the potassium sparing diuretics come medications such as aldactone, and the list goes on. All right. The next one that we're going to be doing is the beta blocker. Beta blockers, beta adrenergic blocking agents, are basically medication that work by blocking the effects of the hormone epinephrine, also known as adrenaline. You know that epinephrine produces what we call the fight or flight hormone, right? So by blocking this hormone now, basically it causes the beating of the heart to decrease. Therefore, the heart beats a lot slowly, and you're going to find that naturally the blood pressure will go decrease. So your blood pressure will get lower. There are a couple medications that come under the beta adrenergic blocking agent. You have the acebutolol, you have the atenolol, you have the metoprolol. So sometimes with the blood pressure medication, what you can do to know the different class of medication, as say the beta blocker, they normally have the lol on it, LOL, lol. This is not always so effective, but most of the time you can use that as a marker to know the different class of hypertensive medication. All right. Guys, it's important to note that even though beta blockers help to reduce blood pressure, it's primary use to aid in the prevention, treating of heart conditions such as irregular heartbeat, chest pain, angina, along with other things that are heart related. So it's not just to reduce blood pressure, but it also helps in improving heart condition, preventing some of them, and treating those that already exist. All right, ACE inhibitor. The word ACE inhibitor, the word ACE stands for angiotensin converting enzyme, which produces a chemical called the angiotensin 2. This chemical causes constriction of the blood vessels. So ACE inhibitors basically blocks the action of the angiotensin 2, which leads to a reduction in the blood pressure naturally. There are many different types of angiotensin inhibitors. Some of them are like captopril, enalapril, along with the others that I've listed in the slides. Calcium channel blockers. Calcium channel blockers basically work by slowing down the path of calcium through the cells of the heart and the blood vessels, which causes the blood vessels to widen and also help the heart to beat a lot slower. So therefore the blood pressure naturally decrease. Some of the medication that comes on the calcium channel blockers are like nifedipine, amlodipine, and the others that you will see in the slide. Guys, as I said, if you want this slide, let me know. Leave your email address below and let me know what else you'd like me to go in depth on, even though this is not much of an in-depth video. What can I say? I'm going to make some links below, so me tell you where me get information from. You guys can go there and read up and do what you have to do. I wish you all the best in your nursing careers. For those who are not nurses but just watching to learn something new, I really hope that this video actually help you. You actually learn something from it. You know, may the Spirit of God continue to bless, guide, and protect you guys. Good health and strength over all of you guys. Have a good one.